demonstrate how to properly examine the abdomen. So to begin with, we have to properly wash our hands.
Hand washing technique. Step 1. Wet your hands with water. Step 2. Apply soap. Step 3. Rub your hands palm to palm. Step 4. Wash the backs of both hands and in between fingers. Front to back interlocking. Step 5. Palm to palm with fingers interlock. Clasp your hands together and rub. Step 6. Rub your fingertips in the palms of your hands. Step 7. And then clean around the thumbs. Step 8. Finish off with the wrists. Step 9. Rinse hands thoroughly with water with the same steps and Step 10. Dry with paper towel. Use the towel to turn off the tap. Done.
Now that we have properly washed our hands, let's start the examination. I am Dr. Arellano, and today I'm just going to examine your abdomen. So may I know your name, please?
I am Marlena Marisa,
And your date of birth?
January 21, 1990.
Okay. Ma'am Arellano, is it okay if I expose your abdomen and touch it to examine your abdomen?
Yes.
Thank you. So may you lie down, please? Is it okay if I pull off your shirt?
Yes.
Preparation of the patient. Make sure patient's urinary bladder is not full. Position the patient properly. Put patient in the supine position with a pillow under the head and a small pillow under the knees with the arms on the sides. Drape and adequately expose the abdomen from xiphoid process to the symphysis pubis. Examiner should be on the right side of the patient and examiner's hand should be warm with short nails. Be gentle and approach patient slowly and avoid quick unexpected movements. Before palpation, ask the patient to point any areas of pain and examine them last.
Now that you've positioned yourself on the right side of the patient, let's now move on to the proper sequence of examination. So starting with inspection, followed by auscultation, and then percussion and palpation, lastly, the special examination.
Hi po, I'll start the inspection of the abdomen wall, but first we'll start with measuring the abdominal circumference, if that's okay. The patient's abdominal circumference is 34.5 inches at the level of the umbilicus. The patient's abdomen is symmetrical and protuberant, with no visible masses or bulges. The patient's abdominal skin is brown in complexion, with hyperpigmentation at the left lateral surface starting at the midclavicular line. There are no visible superficial veins. The umbilicus is inverted, with no lesions or discharge noted, and expansion upon inspiration and contraction upon expiration. No visible striae. No visible peristalsis. No visible pulsation, and there are no visible superficial veins noted.
Good afternoon, sir. Ako po si Dr. Abdomen, pero ang student doctor niyo po. Ngayon po ay papakinggan ko ang bowel sounds. Bowel sounds is 15 cycles per minute. No bruit heard over abdominal, aorta, both renal arteries and both iliac arteries, and no friction drum heard over right upper quadrant and left upper quadrant.
On light palpation, we are looking for pain on the surface, palpable masses and rigidity on the abdomen.
There are no tenderness and masses upon light palpation.
On deep palpation we are looking for organomegaly, typically on the liver and spleen, and masses situated on the intestines.
Liver and spleen enlargement noted. The abdominal aorta is palpable upon execution of deep palpation.
Good morning, sir. Ako nga pala si Charmaine Arceo, yung pong student doctor na mag-examine sa inyo ng inyong pong liver at spleen. Kung maaari po ba, humiga po kayo ng maayos at pakitaas po ng inyong damit.
Okay ba?
Place your left hand under the patient at the 11th and 12th rib, pressing upward to elevate the liver toward the abdominal wall. Place your right hand on abdomen, finger pointing toward the head, and extend it so the tips rest on the RMCL. Press gently in and up. Ask the patient to take a deep breath. With your left hand, reach over and around the patient to support and press forward the lower left rib cage and adjacent soft tissue. With your right hand below the left costal margin, press forward and toward the spleen. Begin palpation low enough so that you are below a possibly enlarged spleen. Ask the patient to take a deep breath.
So the liver and spleen are not palpable.
Test for fluid wave. Ask the patient to press the ulnar side of one hand firmly on the midline of the abdomen. This pressure will stop the transmission of a wave through fat. While you tap one flank sharply with your fingertips, feel on the opposite flank for an impulse transmitted through fluid. Finding: negative for fluid wave. Test for shifting dullness. With the patient supine, begin percussion at the level of the umbilicus and proceed downward laterally to the right. Mark the point on which the sound changes from tympany to dullness. Have the patient roll in onto one side and repeat percussion at the marked area, moving toward the umbilicus. Finding: areas of dullness and tympany remain unchanged. McBurney's point is a point over the right side of the abdomen that is located 1/3 of the distance from the anterior superior iliac spine to the umbilicus. This point roughly estimates where the appendix is located. Deep tenderness at the McBurney's point is called McBurney's sign, which is an indicator of acute appendicitis. I will demonstrate how to find the McBurney's point. You first started from the umbilicus, and then you are going to find the right anterior superior iliac spine by palpating with your whole hand, feeling for the point that is sticking out. You will now draw an imaginary line from the umbilicus to the ascis, and you are going to estimate about 2/3 downward. And that is now roughly the location of the appendix. You can now proceed to the examination of tenderness. Blumberg's sign is also called rebound tenderness. It refers to the pain upon the removal of pressure that is applied to the patient's abdomen. It may be seen in conditions like peritonitis and acute appendicitis. After locating the McBurney's point, apply pressure by gently pressing down the abdomen. If the patient suddenly experiences pain upon the release of pressure, it is positive for Blumberg's sign. MARKLE'S sign or jar tenderness is used for ambulatory patients with rigid abdominal muscles, thus preventing examiner from eliciting rebound tenderness.
Ma'am, pwede po ba kayong umubo? May naramdaman po bang masakit?
Wala po.
Pwede kayong tumingin kaya, tas tuwid yung tuhod, tas sabay bagsak? May naramdaman masakit?
Wala po.
Okay. Sige po, higa po. Okay po. May naramdaman masakit? Kaya po. Okay, taas.
Rolfsing's sign or rebound tenderness is a pain felt by the patient away from the site of pressure. Pain felt in right lower quadrant when pressed and release of pressure on the left lower quadrant.
Pindutin ko lang po tapos pag-release ko, sabihin po sa akin pag may masakit. May masakit po? Wala po. Okay.
Psoas sign. To demonstrate, ask the patient to lie supine. Place your hand above the lower thigh. Ask the patient to raise her leg at the hips while pushing the leg downward against it. Just let me know if you feel any pain. Another way, ask the patient to lie on the left side. Ask her to raise her right leg at the hips while pressing downward against it. Just let me know if you feel any pain. If pain felt at the right side, suggest appendicitis, because the right iliopsoas muscle lies under the appendix when the patient is supine. Obturator sign. Ask the patient to lie supine and flex the leg at the thigh and knee to 90 degrees. Hold the leg above the knee and grasp the ankle and rotate medially and laterally. Just let me know if you feel any pain. If pain felt at the right lower quadrant, suggest inflamed appendix, because inflamed appendix causing irritation of the obturator muscle.
Murphy's sign is seen in acute cholecystitis, which is an inflamed gallbladder. You may palpate the patient's right upper quadrant and ask him to take a deep breath in. As the diaphragm relaxes, the patient's inflamed gallbladder catches in your fingers, causing the patient to feel the pain. To demonstrate, you may place 2 to 3 fingers beneath the costal margin on the patient's right hand side and ask him to take a deep breath in. Could you take a deep breath in for me? Ouch!
Boas sign is an area of hyperesthesia between the 9th and 11th rib right side posteriorly.
Thank you, Dr. Pinzon.